Maine Medical Center is a tertiary care medical center,
but also partners around the state, from medium-sized hospitals all the way down to the critical access hospitals in our rural communities.
We have the acuity here, so you really get a good feel for everything.
We are preparing our residents to practice rural internal medicine and geriatric medicine.
We have one of the oldest states in terms of average age.
Most of our older adults live outside of the urban areas. That population needs highly trained, competent physicians to care for them.
The program is small, so you get to work with your mentors like on a one-on-one basis.
They're required inpatient and outpatient geriatrics, as well as required rural rotations.
You have lots of opportunities to learn.
Some of your best learning is going to be from following patients over time. And with this program, you're going to develop that panel earlier in your career.
You have kind of a community kind of right when you come in. You get to know your other residents, and I think it's a pretty friendly environment. There's a lot of kind of support and camaraderie.
Because we're a small program, we really are allowed to have a one-on-one relationship with all of our learners.
Our faculty are very skilled, well-trained, experienced, but very approachable.
It's a nice balance of faculty and the fellows.
Our residents can really personalize this training experience for them.
You automatically kind of have different rotations in the outpatient geriatric kind of world and geriatric center.
We work at the hospital setting, we work at the nursing home, being a primary care providers for patients living in assisted living facilities.
They're actually going to be out in the VA centers around the state, meeting with specialists who take care of patients where they are.
It's easy to get to know the different types of places that you could work.
I love Portland. I love Maine.
You can go like literally 10 minutes from the center of town, and there's nice little hikes.
I love the Eastern Promenade. It's such a beautiful place to be with view of the water and the boats.
Portland is an absolutely outstanding city. We have the best of the restaurants, and we have a great cultural scene, and we have all sorts of sports. You see the ocean from, your daily drive to work. You go further up the coast and you can see Acadia National Park. The types of beauty within Maine is something that you won't get anywhere else, and the accessibility to it.
Whether you love the water and the ocean or the lakes and the mountains, it's just the ease with which you can do all those things is the difference.
Our one mission is to preserve the autonomy and the independence and the quality of life and the function of older adults. You have the benefit of two very strong, well-established programs and faculty that is incredibly engaged, and also being able to practice in parts of the state that really will give you unique and important clinical experiences to allow for your growth as a clinician.
If you want to do residency and a fellowship in geriatrics, this is the best program. You will not regret being here.
Our residents and our fellows are really the heart of what we do.
People come out with the skills to be an internist geriatrician in smaller communities and rural communities.
You are able to build these strong connections that will last a lifetime.